Gonzalez here at Miami Community Health. We're here for another important health topic with you today. And of course, it's holiday season. Everybody's in the holiday spirit. Thanksgiving has come and gone. And now everybody's thinking about Christmas. And everybody, you know what everybody's thinking about? They're thinking about their Christmas gifts. And I'm sure there's many of you out there, especially the ladies, probably some men as well, who are looking for their plastic surgery gift. They're looking for their beauty gift, their wellness gift. So what better than to bring our own Santa with us here today? We have Dr. Nathan, Nirmal Nathan here with us to talk to us about holiday season, plastic surgery in the holiday season. And we're going to talk about safety in plastic surgery. So welcome, Nirmal, welcome.
Thank you, Tony. It's a pleasure to be on your show, and thank you for inviting me.
All right, well, pleasure. So let's first talk about a little bit about yourself. Tell us a little bit about yourself, and you're a plastic surgeon. Why would you want to be a plastic surgeon?
Well, plastic surgery is a passion of mine. I had the good fortune of being exposed to surgery at a young age. My father was a surgeon in the Air Force in Homestead, and he did facial plastic surgery in ear, nose, and throat for decades. And that exposure really influenced me early on. So I had that interest in surgery. And then progressing from there, I looked at the different fields: general surgery, orthopedic surgery, plastic surgery, and the combination of artistry and technical skill is what really attracted me to the field. Also, the ability to impact patients' lives in a very visible way is another major factor that allowed me or that influenced me into going to plastic surgery. People think that plastic surgery is superficial. When you hear plastic surgery, you think the word plastic.
Yeah.
But that is actually why we call it plastic surgery. It's a Greek root for plastikos, which means to shape or mold. And that's really what I get to do, is in my own subtle way, shape or mold and change people's lives.
No doubt. You're not only changing maybe their deformity that they're having in their nose, but you're also changing their lives because the way it impacts them in their daily life and their social life.
Exactly.
Wow. Yeah. So why Miami? I know you're a hurricane. We're hurricanes, of course. And
Go Canes.
Go Canes. Not a great year, but why Miami?
Well, I spent most of my life in Miami. I grew up here as a child, and I went to medical school here, and I always had an affinity for South Florida. And I had the opportunity to train in California and enjoyed it very much. But something brought me back to this community. I love the diversity of Miami. I love the particular cases that I get in Miami, not only my cosmetic cases, but I do a lot of facial reconstruction after skin cancer. That's obviously big in South Florida. We get so much sun. And so it's those combination of factors that led me back down to Miami.
So you already mentioned a little bit about what you do. You're doing some reconstruction. You're helping people who suffering from cancer and have deformities. You obviously do cosmetic surgery. So tell us a little bit about, plastic surgeons in Miami are literally almost a dime a dozen, right? And so why would I bring, Dr. Nathan Nirmal here with us to talk about plastic surgery and, of course, the safety of plastic surgery during this holiday season? What are the procedures you do?
Sure. Thank you, Tony. I'm fortunate that I had a pretty broad-based training. I did a plastic surgery training, and then I did a specialty called craniofacial surgery after that at Miami Children's Hospital. And it was even though it was at Miami Children's, it was a combination children's and adult fellowship. So I did very complex cases. Cleft lip and cleft palate is more straightforward, but more complex congenital cases, kids with massive craniofacial deformities. And then also I did a lot of cosmetic surgery in adults. And so I have a broad skill set where I can do the body work, I can do the face work. And that's part of what also drew me to your initial question of plastic surgery. I never get bored. Every day I'm doing different cases. I do a high volume of all the index plastic surgery cases, but I do rhinoplasty, I do faceless, I do a lot of revision breast work, I do some body work. I also do, as I mentioned, a lot of facial reconstruction after skin cancer, which is very rewarding to me, to patients that oftentimes don't have access to plastic surgeons. And so that's the vast majority of what I do. I used to do very complex cases. It's a field called microsurgery, where I'm transferring tissue from one part of the body to the other, covering debilitated patients' hearts with muscle so that they can heal, salvaging limbs so patients could walk again. As I've gotten busier in my practice, I've had to narrow down what I do a little bit because there's only so many hours in the day, but I still keep things pretty broad. And back to your initial point about in the holiday season and what people are doing, I also do a large volume of injectable and minimally invasive procedures, when we're talking about anti-aging procedures, I think it's important that patients and people understand that there's a whole range of options available. It's changed tremendously over the last 10 years. And when you go to a plastic surgeon's office, surgery is not necessarily the only option. And so I do the whole range of injectables. It's a lot of fun. And I'm blessed to have a very great client base.
So this holiday, so we're talking about the holidays. Everybody wants a gift for Christmas. And I know that plastic surgery is big during the holiday season. Everybody wants to look their best in the holiday season. So what are the things that, the women and the men are looking for this holiday season from their, let's say their cosmetic surgeons? I don't want to use the word plastic anymore. You kind of got spooked with that word. But anyway, with their beauty surgeons.
Sure. It's interesting. The holiday season, we always have a little bit of a ramp up. It's a little bit counterintuitive. You think that it's the holiday season and people may not want to do surgery. But for the surgical procedures, a lot of patients want to have that time off to recover, the privacy of being able to take some time off during the holiday season, be at home with their family to recover from surgery. And then we have the whole range of minimally invasive procedures, things like Botox, Dysport, injectable fillers, laser treatments, where clients and patients are having events coming through the holidays and they want to look their best. And you also alluded to another very important point that's very interesting for my practice is I get more and more male patients. There used to be a stigma, oh, plastic surgery is only for women. And I see more and more men that are wanting to look their best, both in the personal and professional settings. And it doesn't have to be obvious. I always say plastic surgery should whisper, not scream. And that's what I like to think that I deliver, and a lot of great surgeons in the city deliver. So
yeah, I always remember this story. I was invited to another surgeon's house for a holiday dinner, let's say about 10 years ago. And at the table was a plastic surgeon, and he's introducing himself, and he's telling me, no, I operated on my mother. And the mother looked like she was going through, she had just gotten through like
a wind tunnel.
Right? And you're right. I think that's the point. You want to, you want it to be gentle. You don't want to look like, you've just been stretched or you just got off of a F-15 fighter pilot, a fighter jet, So you talked about some of the minimally invasive procedures. And then what about Miami? You get a lot of patients from out of town as well. Miami is an attraction. Of course, you're an attraction as well. So what about those patients that are coming from out of town?
It's very interesting. I've been fortunate. I have patients from pretty much almost every state in the United States and also the Caribbean, Europe, and Asia. I'm sure, Tony, you have a very mature staff. You're internationally recognized for what you do. You get patients from all over. One of my main concerns is making sure before the patient makes a commitment to travel, understanding what their goals are. And that's where teleconsults, telemedicine has come to help me quite a bit. Assessing patients' needs before they come, and then also making sure that when they get to town, that their surgery is done as safely as possible. So it's very interesting. Miami is a very body-focused city. A lot of my clients locally come to me for body work. From other parts of the country, they're coming to me for face work, things like rhinoplasty, eyelids, facelifts, things of that nature. And it's really quite variable. It's really quite variable. The motivations are different for every out-of-town patient. Some see Miami as a quote-unquote mecca for plastic surgery, and they're just looking for a well-known surgeon who is established in the city. There are other patients who don't want to, frankly, pay the prices in Manhattan or Beverly Hills that are maybe 3 to 4 times the average cost of a good plastic surgeon in Miami, and they're looking to have more value. And then there's a third category of patient that they just want to spend some time in Miami, recover in a nice setting. Miami's not the worst place to recover in the wintertime if you're living in New York, right?
No doubt about that, yeah. So, of course, we're so close to Christmas now that if I'm trying to get to a holiday party, I'm not going to have major plastic surgery at this time because I'm not going to look holiday ready. You mentioned already injectables. Is that something that you can do? And what are the different injectables that you can do that I'll be ready in a week or two to be at a holiday party coming up? Because now we're just the first few days of December. By the time I see Dr. Nathan, I have surgery, and he does surgery on me on the 15th of December, if you possibly could, then I'm looking like a monster by Christmas Day, right? So, because, there's going to be swelling.
Yeah.
I do surgery. I'm a surgeon. I know that. So what are those injectables and what can I do now quickly that I can make me ready for, next week I got a good party coming up?
Yeah, that's a great question, Tony, and that's a big part of my job is counseling patients as to what's out there because the minimally invasive, the injectable space in cosmetic surgery has grown so much over the last 10 years. And I like to start in every consultation educating patients, just like you do in your field, and getting them to understand the facial aging process, right? And I usually break it down into three categories. There are dynamic wrinkles from muscle movements. That's what forms the forehead wrinkles and 11s between the eyebrows. The second category is photo aging, which is due to sun exposures. That's where you can get brown spots and fine wrinkles from the sun. And then the last one is volume loss and volume descent. As we all get older, we lose volume in our cheeks, we get some jowls, we lose our contour in our necks. And there are different treatments for each of those issues. And part of it is educating patients that you're not going to get facelift results with injectables, but you will get improvement. And it's an investment and it takes time. So a patient that's coming to look 10 years younger, 2 weeks before Christmas, I'm probably going to decline that if they don't understand that this is a process and you need to take the time to invest in it for a month, for 2 months, doing it over time, figuring out what works. Does Botox or Dysport work better for you? Those are both neuromodulators that are used to treat wrinkles on the forehead, right? If you need filler, 15 years ago, there were only two types of, with generalizing, there were two types of filler, Restylane and Juvederm. Now there are 20, and they all have different densities and different properties for different parts of the face. So part of what I do is educating patients to develop a customized plan for them, and then also putting them on a maintenance regimen so that after they're out of the holidays, they're still doing what they need to do to maintain and look their best.
So I think the take-home message is that he can't get you ready in a couple of weeks, but what you should do is ask your spouse, your partner, your mom or your dad for a gift card from Dr. Nathan, and he'll start in the new year. You start in the new year. It's going to take months. We'll get you ready for summertime, right?
Right.
We'll get you ready for summertime. All right. So obviously, social media is very big. Our program, of course, Miami Community Health, is on social media. We're on the internet, and that's a big way to promote and give information, and educate. And plastic surgery has been huge. I can tell you in my world, as simple as somebody removing a sebaceous cyst, which is a skin gland cyst, there is a TV show of somebody doing grotesque stuff on the TV, which I think is a disgrace to the medical society that we allow that. And so social media could be beneficial, could be dangerous. How you, as a professional plastic surgeon, a reputable plastic surgeon, how do you deal with that social media? And what are some of the tips you could tell our viewers who are listening out there and get so much information from social media about plastic surgery?
That's a great question, Tony. And it's something that I struggled with for years. I'm not a big fan of social media in general. Like you, I have academic credentials, publications, and you want to maintain the respected nature of the medical field, right? We don't want to venture into territories that are out of the realm of professional standards that are being generated from social media, right? And you brought up the issue of this cyst removal, which is a simple but very relevant example. And so I kind of shied away from it for years. But then I realized that, you know what, this is where the world is going. And if you only allow the people on the extremes to define that space, to define the social media space, then we're doing the patient a disservice. So a big part that I do on my Instagram, Miami Plastics, is I educate patients, rather than showing them shock photos of, squeezing out a cyst or dancing around with a crown on my head. What I try to do is give them quality educational content that can empower them with knowledge and also help them make educated decisions if they're deciding to proceed with the surgery or minimally invasive procedure. Things about what do you need to look for when you're in a consultation for a particular surgery? What kind of questions do you need to ask? What are the credentials you want to generally look for in a plastic surgeon? What are some warning signs when you go into an office that may be indicative that they're not adhering to standards of care? It's a very important question, and it's something that our society, I'm an officer in the Miami Society of Plastic Surgeons as well, that we're focusing on is showing patients that, the duck lips that you see on social media, the extreme implants that are the size of balloons on social media, That's not the entire plastic surgery world. There's a whole realm out there. And so social media is starting to be redefined. And my opinion on social media has changed dramatically from, oh, this is just about the extremes, to this is a way that patients with certain values, concerns, judgments and choices can navigate their way to the right surgeon. When patients come to me from social media, it's as if they've already known me, because they've seen so much of my content on Instagram, on TikTok, that they're just there to confirm what they've already learned and get the rest of the details about what they want to do.
And also make sure that they're a candidate, that you can help them.
Exactly.
Because
That's the
people
most
come in
important
with
thing.
unrealistic expectations, right? Because as you know, and I know, social media is a lot of fake out there.
Right.
People, they make believe that they're flying around in private jets, or that they look like this or look like that. And when you've always seen that what they look like on social media and what they look like in real life.
Right.
So,
That's a great
can't,
point.
you can't, make everybody into anything. So obviously social media can be beneficial. You've used it to educate your patients, which is great. You use it to portray what the services that you could provide, but social media at the same time can be dangerous because it attracts a lot of patients, and patients will be drawn by large social media followings and so forth. And patients can get into danger. So let's talk a little bit about danger of plastic surgery. And a lot of plastic surgery, of course, Haven down here in South Florida, a lot of plastic surgery centers. So how do, patients, how do viewers navigate through the danger of plastic surgery and dealing with, dangerous surgeons, unqualified surgeons, centers that are not safe? Like I tell my patients, what happens if something happens in the operating room? Do they have the qualified professionals to deal with you? So how do you deal with that?
Yeah, it's a great question. I'm a little pensive about it because I don't think there's ever been a more challenging time for a patient to navigate that framework, and just like news and politics, to sort out the misinformation from the true information, right? And there are many people that can purport themselves as experts on social media. When you actually dig deeper, their qualifications or record may be suspect. And so, word of mouth is always a good factor to rely on. So if you found a surgeon that you like on social media, ask around. If you know any patients that have been operated by that surgeon, ask those patients. Get away from only their social media, which is essentially a marketing channel. Use that as one data point. Go to Google, look at their reviews, right? Look up any background on them if they had any trouble in the past, which you can easily find on Google, right? And then look at, when you get in for the consultation, if you decide to make the consultation, look at where you're at. Is the place being run like a factory where people are just being treated like a number and being passed through? Are you meeting your surgeon in preoperative consultation, or are you going to meet them on the day of surgery? I think that's a big red flag. I think, and it's just my opinion, but I think every surgeon should meet their patient before the day of surgery to do an assessment and
interview their surgeon.
Figure out
it's a two-way interview.
Yeah, I mean, don't you feel similarly,
I
Tony?
agree. Yeah, you have to. Not only are you interviewing the patient to see if they're a candidate, they should be interviewing you to see if you're a qualified individual.
Absolutely. And that's something I tell my patients is, let me tell you about my practice. Let me tell you about the values I stand for. Let me tell you about the safety protocols that I have in place. And you can decide if I'm the right fit for you, because like you said, it's a two-way street, right? And it's a partnership, and the patient ultimately has to feel comfortable because they are the priority. And I think if you use that kind of framework, you're going to get to the right place. You're going to narrow your list down to a few surgeons and be able to make a good, safe decision.
All right. So we cannot go through the entire show without talking at least about a surgical procedure, right? All the viewers, they want to see our cosmetic surgeons. They want to know about, facelifts. They want to know about injectables. They want to know about breast augmentation, enhancements, or lifts. But one of them that I've seen a lot at the hospital, and remember, I don't do cosmetic surgery, but I see them at the hospital as somebody as chief of surgery at my hospital, where they come in with a bunch of problems and complications, is that Brazilian butt lift. And which, when we're running the list of like patients at the hospital, and our nurse practitioners go, the patient had a BBL, and it took me a long time to understand what BBL standing for, but I don't know if that's the real acronym for the Brazilian butt lift. So, what is it, and is it safe? Is it dangerous? What is going on? Everybody wants, now a bigger behind, right? I guess.
Right. You're right. Before I go into that, let me first say that, and I'm sure you can say this as a very experienced surgeon, no surgeon is complication free, right?
Correct. Every surgery
So,
has a potential complication.
so every surgery has risks and surgeries have complications. But what you're alluding to, which is, in my opinion, ER dumping, right, is what does the surgeon do when they have a complication? Do they take care of their patient or do they just pass it off to somebody else, right? But back, and we'll get into that. But back to your question about what a Brazilian butt lift is, it's essentially a procedure where liposuction is performed around the body, usually the waist, abdomen, flanks, sometimes the arms and legs as well. And that fat is prepared, harvested, and injected into the buttocks to add volume. And it is currently the most dangerous procedure in plastic surgery.
Wow.
And the reason is that when it's injected in the wrong plane below the muscle, that fat can enter the bloodstream through the veins, go to the lungs, and cause what's called a fat embolism, where the patient will stop breathing and go into cardiac arrest. And there have been several deaths related to that in South Florida. And so, as I mentioned, I'm part of the executive committee of our society, and we've been doing investigations on both the local and state level to see why this is occurring and how we can make it safer. And there are definitely some factors that we've seen that can raise the risk of fat embolism.
Okay.
One is injecting deep to the muscle, like we discussed. There's a zone on the buttock that's higher risk. And generally, the higher volume that you go, the higher risk of the fat embolism. So when I do Brazilian butt lifts, I try to guide the patient. You don't want to necessarily go Khloe Kardashian, right? You want to have a more natural look to your buttocks, because when you start going to the higher volumes, right, that's when you tend to run into problems. And anatomically, that's because you can only fit so much fat above the muscle. When you start reaching that limit to how much the skin and soft tissue can stretch, you have to go below the muscle. And that's where the danger zone is. I don't think in this day and age, and this is just my opinion, but I think the general consensus of my colleagues is that no surgeon in 2021 should be injecting below the muscle for Brazilian butt lift.
Is it that they don't know what they're doing? Is it an unqualified surgeon? Is it back to your original comment that, we have, surgeons who are not qualified in centers that are not certified who are doing this? Or is it just an error, or is it too much?
A great question. And that's something that we've put as a society and as an individual, we put a lot of thought to. Historically, board certification from the American Board of Plastic Surgery has been very important. And it still is when you're looking for a surgeon. But a lot of centers have been making so much money that they've been able to hire board certified plastic surgeons. And again, I'm not trying to speak badly about any center, but I do think there are certain factors that when you take it into totality, increase the risk. I'll give you a quick example. Most surgeons who are very experienced in Brazilian butt lift and liposuction, if they're performing the entire procedure themselves, will take about 3 hours to do the procedure. Okay. So if you're doing a 12-hour day and you have the most perfect turnover time, Tony, on a 3-hour surgery, how many do you think you could do in a day?
3, maybe.
3? I think that's reasonable too, right? And liposuction, I'm sure you did in your training. It's exhausting, right? It's well, I can tell you it's exhausting. You have to be focused. You have to know where your cannula is at all times, right? And you're putting a lot of effort to get the fat out. And if some of these centers under one surgeon, they're listing 10 procedures a day, 12 procedures a day. My question would be, how is that
doing that?
How is it possible?
That's
right?
not possible, right? They're not doing the procedure.
Exactly. And so it's an issue of supervision. It's an issue of how much volume you're injecting. And then it's also an issue of safety protocols that you have in place. So when I do a Brazilian butt lift, I use something called an ultrasound assisted guide to show me where I'm injecting the fat. That takes time, right? I have to get the imaging probe on.
It takes experience.
It takes experience. I have to inject in the right plane. And I still tell patients this is not risk-free, right? But I'm doing everything in the safest way possible. So if you don't have the ultrasound, or more commonly, if you're doing so many cases that you just don't have time to do this technique, right? Then are you doing the safest surgery for the patient? And I think that the data that the Florida Board of Medicine is collecting currently from what I've heard, again, I don't want to, overstate this. From what I've heard, confirms what I'm saying.
Wow. So obviously, a Brazilian butt lift is an appropriate procedure if that's something you want. It's another form of, I guess, remodeling your body and making you happy. No doubt about it. And of course, if you do it with an experienced surgeon, experienced center, and you do it safely and safe volumes, it's safe. Now, before we close, and I ask you some final comments, what about cost? I mean, I go down the highway and I see that you can, have breast augmentation for $50,
Right.
And is cost playing part of that? I think a lot of people are drawn because of cost. Not everything cheap is good, and not everything expensive is good either. How does that relate? How does a consumer evaluate cost?
Right. That's a great question. I can tell you that an average set of breast implants costs anywhere between $800 to $1,000, right?
Just the implant.
Just the implant.
Just the implant.
A well-run OR will take $1,000 to $2,000 an hour to run, right? So when you have an hour and a half case that costs $3,000 and you have a board-certified anesthesiologist you have an anesthesiologist taking care of you, you do the math yourself. Where's the margin for the surgeon, right? And so I think that there are some tools that you can use. There's a website called Real Self, which shows the average range of plastic surgery procedures across a broad range of surgeons. And you can see, am I on the lower end of the quote? Am I mid-range? Am I on the higher end of the quote? And that could be a guide for you to say, hey, this is at the absolutely rock bottom part of a quote. When I went in for the consultation, the place was packed. There's no sitting room only. I didn't meet the surgeon. And you take all these data points separately and you put together and say, hey,
something doesn't jive.
Exactly.
Well, and so that Real Self, you report in there your prices?
Exactly.
So every plastic surgeon puts themselves in there. They say what their prices are.
I don't know if it's every plastic surgeon, but they harvest data. Yeah, exactly. Okay. But they have a pretty broad range, Okay.
So that's good. Good information. All right. So we've learned a lot in this holiday season. And before I thank you, what is in the future of plastic surgery, of cosmetic surgery, of making us look younger? Now, of patients, I've been in practice now 25, 27 years, and patients, I hadn't seen them in 10 years. They go, you haven't aged a bit. And I say, well, it's because I have the fountain of youth at my house. And I tell them, you come to the back of my house, I have the fountain of youth, and we'll give you a little water. But so what is the future? Besides the fountain of youth, what is the future to keep us young and keep us beautiful?
Sure. I think that there's a broad range of things out there in the both currently out here and in the future pipeline. There's really exciting in the anti-aging field. And part of that is what we alluded to. We're having newer types of fillers that last longer, that have different properties so we can give more customized and tailored results. We have more neuromodulators coming out. So, things like Botox that have different properties. There's a topical Botox that might be coming out that I'm a little skeptical of, but I'm excited to see. Fat grafting is a big trend where we harvest fat and inject that into the face and other parts of the body to add volume. Stem cell therapies, we're just at the infancy of anti-aging stem cell therapies. All of this needs to be vetted scientifically, but it's very exciting. And then, of course, there's a whole range of energy-based devices that are coming out using, the radio frequency probes we used to use to ablate liver tumors are being used in different ways to tighten the skin, to provide different results. Plasma technologies are coming out. I have a machine called Renuvion in my office that I use in the operating room to tighten the skin in ways that were not possible years ago. And so it's really exciting times. That's just on the cosmetic surgery side. As we mentioned, we focus on cosmetic surgery. Plastic surgery is a broad field. Ed Rodriguez, who's a chairman at NYU and is a Miami native and of Cuban origin, is the pioneer in the world for face transplantation. And it's amazing what he's doing in New York for people who have been disfigured and scarred, transplanting entire faces so that they can, go out into public and lead normal lives. So all of these fields are in its infancy. It's very exciting. And I think in 10 or 20 years, the field is going to be very, it's going to have very little recognizable to what it is currently.
Wow, that's great. Great news. So yeah, look at great news for the holiday season. obviously, we want to thank Dr. Nathan for being with us, Nirm.
Thank you for
being
having
here.
me, Tony.
Thank you for giving us great information. And, our health show is not only always about medical problems and medical procedures and about COVID. We've talked today about what are the best things for you in this holiday season, the safety of cosmetic surgery that many people are concerned about, of course, and of course, the safety and the danger of social media. So once again, I want to thank you for being with us here. If you need him, Dr. Nirmal Nathan, he's on social media. He's a great friend. He's a great doctor and a great family man. Of course, we know his family very well. And from Miami Community Health, Dr. Anthony Gonzalez signing off. You guys have a great day and a great holiday season.